So early detection combined with effective therapy is how we have reduced breast cancer outcomes globally. In high-income countries, we've seen a reduction of 40% in breast cancer mortality between the 1990s and the present time. And the question is, how do we translate this into limited resource settings? The first challenge is having women present and be recognized when the disease is early. And by early stage, what we mean is that at least 60% of the invasive breast cancers are stage 1 or 2 at diagnosis. The reason that that's a threshold is that every country that has succeeded in reducing breast cancer mortality achieved at least that step. And that requires education of the public so that women would understand, why is it that I would come in because I have a subtle finding in my breast that doesn't necessarily bother me, but also education of the providers so that when a woman presents with a subtle thickening or a mass, that they are in fact recognized as possibly having breast cancer. The second pillar is prompt diagnosis, because it's very common that we have great delays from when the patient presents to when a cancer diagnosis with pathology is made. 9 months have been published results in Mexico, over a year in Peru. And the target is for an accurate diagnosis to be made within 2 months. The reason for that is that at about 3 months, that's when we start to see declining breast cancer mortality. So having a threshold and recognizing that actually most people coming in with breast symptoms don't have cancer. So 9 out of 10 women presenting with a lump, 1 will have cancer, 9 have benign findings, and we need to sort out which is which. The third pillar is management. So that means multidisciplinary care with surgery, radiotherapy, and drug therapy. But it also means supportive care. It means all of those things that help the person get through their treatment and to manage the symptoms of their disease when those are problematic. And a key pillar indicator for us, a performance indicator, is treatment without abandonment. That is, treatment taken to completion. It's very common in many parts of the world that women will start their therapy but not finish it. And if you get half of your chemotherapy doses, that's the worst of all worlds. That means that you get the side effects without the clinical benefit, and therefore the drug utilization was wasted. So we talk about procurement without necessarily asking the question of the right drugs getting in the right patient in the right time course.